So today we'll begin a simple primary care review on newborn care, the breastfeeding mother. Maternal breast milk. Healthy and exclusively breastfeeding women produce approximately 750 to 800 milliliters per day of milk in full lactation. During the first 2 days, milk volume is low, but increases markedly on days 3 and 4, and then gradually rises to levels seen in full lactation. Milk volume decreases later in lactation after 6 months because of weaning. Breast milk production. Nutrition is an important factor in breast milk production for mothers. Mild or moderate reduction in maternal diet and aerobic exercise generally do not affect milk production. Some decreasing milk volume factors include incomplete breast emptying and infrequent milk expression, as well as maternal smoking, stress, anxiety, fatigue, or illness. Maternal nutrition requirements. Nutritional requirements to support lactation are high, and the nutritional requirements for lactating women are higher than in those who are pregnant or in the non pregnant state. Nutrition intake includes energy intake, protein, vitamins A, C, E, B6, and B12, folate, niacin, riboflavin, and thiamine. Minerals include iodine, iron, selenium, and zinc. The vitamin D content of breast milk is constitutively low. As the result, all infants require vitamin D supplementation to prevent rickets. Diet of fish and shellfish. Fish and shellfish contribute high quality protein and other essential nutrients to the diet. However, a potential disadvantage of fish intake is the exposure to mercury. Breastfeeding mothers should eat 8 to 12 ounces a week, 2 average servings of fish and shellfish that have lower concentrations of mercury, such as canned light tuna, salmon, pollock, catfish, and shrimp. Breastfeeding mothers should not eat shark, swordfish, king mackerel, or tilefish, as they contain high concentrations of mercury. Vegetarian diet. Lactating women on vegetarian diets should be cognizant of the potential risks for mineral, protein, and vitamin deficiencies. Depending on the degree of dietary restriction, calcium, vitamin D, and vitamin B12 supplements may be required to meet recommended intakes for these nutrients. Maternal alcohol use. A small percentage of alcohol is transferred into breast milk. A breastfeeding woman can avoid exposing the infant to alcohol by waiting for 2 hours after a single serving of alcohol to nurse. If a woman drinks more than a single serving, she should refrain from breastfeeding for an additional 2 hours for each serving of alcohol. Heavy alcohol intake can impair judgment or child care abilities and should be avoided regardless of how the infant is fed. Maternal medication use. Most medications are compatible with breastfeeding. The amount transferred from maternal serum to breast milk is usually quite small and unlikely to adversely affect the infant. Breastfed infants are generally not affected by medications with poor oral bioavailability, such as insulin or heparin. Breastfeeding does not need to be interrupted when iodinated or gadolinium contrast is administered for radiologic imaging. Some medications decrease breast milk volume, including dopamine agonists, decongestants, and estrogens. Maternal postpartum follow up. Breastfeeding mothers should have a follow up visit with a clinician until breastfeeding is well established. The initial visit should be within 48 hours after discharge. The subsequent follow up visits depend on the infant's feeding and risk factors. Some infants may need to be seen one or more times again prior to the routine 2-week visit. Thank you.